Hello everyone, it's Megan back with this week's Fix Tip video, and this week I'll be talking about respiratory conditions. So what is a respiratory condition? It's a condition, disease or disorder that affects your lung capacity and overall ability to be able to get air in and out of our lungs efficiently. Examples of these conditions can include asthma, COPD, so chronic obstructive pulmonary disease, emphysema and chronic bronchitis. All of these different conditions can have slightly different symptoms or a way that they affect our lungs. So for example, asthma is when we breathe in a triggering agent which induces an inflammatory response in our lungs, then making it difficult for us to breathe. Whilst emphysema is a reduction in the elastic properties within our lungs, making it difficult to get air in. General symptoms of respiratory conditions can include wheezing, shortness of breath, which is abnormal shortness of breath post-exercise, mucus, tightness in your chest, and coughing. In terms of how these respiratory conditions can occur, they can occur through genetics, which is a major contribution to them, but also smoking, infection, and airborne allergens such as pollen. Now I'll be going into the benefits of exercise and how that plays a major role in managing your respiratory condition symptoms, decreasing your overall shortness of breath, and just being able to manage things and activities in life a little bit easier. So exercise can help increase your overall lung capacity. So essentially being able to breathe air in easier through the lungs, into the blood, into the working muscles, and then breathing that out. So making the whole process a little bit easier. It can also improve your overall endurance and stamina, so walking for long periods of time or doing a certain activity for a long period of time. It can decrease your airway constriction, so loosening up the vessels in the lungs, allowing that air to flow through a bit easier. Improving your overall circulation and energy levels, decreasing mucus build-up in the lungs, and decreasing overall shortness of breath as well. So you can manage your symptoms a lot easier through exercise. It's fantastic to see how many great benefits exercise can have on our lung function and our lung ability. So even if you don't have a respiratory condition, it's really important to maintain a good exercise routine to maintain healthy lung function. If you do have a respiratory condition and want more insight into appropriate exercises and intensity for you in relation to your current conditions, current goals, and current fitness levels, please come into the clinic to see our exercise physiologist and we'll set you up with an appropriate program. Thank you for listening.